Hi friends, good morning and welcome to my channel Mukambika Nursing. Friends, in this video we can see the next set of questions from Fundamentals of Nursing. In the previous video, that is yesterday's video, we discussed first 15 questions from Fundamentals of Nursing, and this is also important questions. We can see the questions, today's question one by one. Question number 16. The position that is suitable for sigmoidoscopy is, and options are option A supine, option B knee chest, option C left lateral, option D both A, B and C. Here correct answer is option D, both B and C. B means knee chest position, C means left lateral position. That is the correct answer. In this question, we will see sigmoidoscopy means is the visualization of anus, rectum and sigmoid colon. And the sigmoidoscopy is performed either knee chest. Knee chest position is also known as genupectoral position or left lateral position. Left lateral position is known as Sims position. So genupectoral or Sims position. Sims lateral position or knee chest position or left lateral position. Here knee chest and left lateral is there. So answer is option D, both B and C. Question number 16. A removal and examination of tissue for the diagnostic purpose is known as. Options are option A culture, option B biopsy, option C sonography and option D MRI. Here correct answer is option B, biopsy is the correct answer. Biopsy means is the removal and examination of tissue for the diagnostic purpose, and this may be performed either open biopsy or needle biopsy or endoscopic biopsy. Open biopsy means through surgical excision and needle biopsy means through using special needles. For example, liver biopsy and also endoscopic biopsy means by through using endoscope. And remaining option culture, sonography and MRI is there. In culture means particular specimen that is having either microorganism present or not, that is culture, and sonography and MRI is the visualization of body parts. Here removal, examination of tissues for diagnostic purpose is biopsy. Question number 18. Term thoracosynthesis refers to the, and options are option A puncture into the pleural cavity for the removing pleural fluid or air. Option B removal of fluid from the peritoneal cavity, and option C aspiration of CSF from lumbar puncture. Option D inflammation of thorax and abdomen. Here correct answer is option A puncture into the pleural cavity for the removing pleural fluid or air is known as thoracosynthesis. We will see what is thoracosynthesis. Thoracosynthesis means puncture by needle through the chest wall into the pleural space for the purpose of removing pleural fluid. Pleural fluid include either blood, serous fluid or pus. And also air is removed from the pleural cavity in case of pneumothorax. That is known as thoracosynthesis. The thoracosynthesis is performed for either diagnostic or therapeutic purpose. Okay, here option A is the correct answer. Question number 19. The term abdominal parasynthesis refers to, and options are option A puncture into the pleural cavity for removing pleural fluid or air, option B removal of the fluid from the peritoneal cavity, option C aspiration of CSF from lumbar puncture, option D inflammation of thorax and abdomen. Here correct answer is option B removal of fluid from the peritoneal cavity is known as abdominal parasynthesis. The main purpose of this abdominal parasynthesis is to study chemical, bacteriological and cellular composition of peritoneal fluid for the diagnostic purpose, and also to drain and exudate in peritonitis, and also to remove fluid and to instill air to create artificial pneumoperitoneum for the treatment of tuberculosis which is affecting the base of the lung. Here correct answer is option B, removal of the fluid from the peritoneal cavity. Question number 20. The term lumbar puncture refers to. Options are a puncture into the pleural cavity for the removing pleural fluid or air. Option B, removal of the fluid from the peritoneal cavity. Option C, aspiration of CSF from the lumbar puncture. And option D, inflammation of thorax and abdomen. Here correct answer is lumbar puncture means is the aspiration of CSF from lumbar puncture is the correct answer. A lumbar puncture or spinal puncture is the insertion of needle into the lumbar region of the spine to remove the cerebrospinal fluid. The main purpose of this lumbar puncture is to administer spinal anesthesia before surgery, and also to administer medication into the spinal canal to remove fluid, that is CSF, blood, pus for diagnostic purpose, to remove sample of CSF for laboratory examination, and also to measure the pressure of CSF. These are all the main purpose of lumbar puncture. Here correct answer is option C, aspiration of CSF from lumbar puncture is the correct answer. Question number 21. Purpose of thoracosynthesis is, and options are option A, to study the chemical, bacteriological and cellular composition of the pleural fluid. Option B, to remove pleural fluid. Option C, to relieve lung compression, pain and respiratory disorder. And option D, all of this. Here correct answer is option D. All of this is the correct answer. As we already saw that this question, that is what is thoracosynthesis, that we already discussed. Thoracosynthesis means puncture by needle through the chest wall into the pleural space for the purpose of removing pleural fluid, that is blood, serous fluid and pus. Okay, here the purpose is to study the chemical, bacteriological and cellular composition of the pleural fluid and to remove the excess pleural fluid which could become infected by emphysema, and also to relieve lung compression, pain and respiratory disorder, and to instill medication into the thoracic cavity. So here all are the purpose of thoracosynthesis. So answer option D, all of this is the correct answer. Next question, question number 22. Most common site for the pleural aspiration is, that is option A, at the second intercostal space, option B, at the fourth intercostal space, option C, at the seventh intercostal space, option D, it can be performed anywhere. So the site for thoracosynthesis, that is the question. Thoracosynthesis is the aspiration of pleural fluid. Okay, here the common site for pleural aspiration is the area just below the inferior angle of the scapula at the seventh intercostal space. So here option C, at the seventh intercostal space is the correct answer. Next question. Number 23. Most common site used for abdominal parasynthesis is, option A, at umbilicus, option B, at symphysis pubis, option C, midway between the symphysis pubis and the umbilicus on the midline, option D, just below the symphysis pubis. Here question is common site for abdominal parasynthesis, and the correct answer is midway between the symphysis pubis and umbilicus on the midline. That is the correct answer. We already discussed this question. Parasynthesis means is the removal of fluid from the peritoneal cavity. Here the question is site. Site is the common site for Paracentesis, abdominal paracentesis is midway between the symphysis pubis and the umbilicus on the midline. And another one site is there, that is a point 2/3 along a line from the umbilicus to the anterior superior iliac spine. That also can use for abdominal paracentesis. Okay. Here correct answer is option C. Number 24. The position given to the patient for abdominal paracentesis is, and options are option A supine position, option B lithotomy position, option C Fowler's position, option D Nietzsche's position. Question is the position for abdominal paracentesis, and correct answer is option C Fowler's position is the correct answer. The correct position is Fowler's position, supported by backrest and pillows near the edge of the bed on either side. Okay, near the edge of the bed. That position is given for abdominal paracentesis, that is Fowler's position. And question number 25. Commonest site for lumbar puncture in adult is. Options are option A first lumbar vertebrae, option B between L3 and L4 vertebrae, option C between thoracic and lumbar vertebrae, option D between lumbar and sacral vertebrae. Lumbar puncture, the site, common site of lumbar puncture, and the correct answer is between L3 and L4 vertebrae. Lumbar puncture means, or lumbar puncture or spinal puncture is the insertion of needle into the lumbar region of the spine. The common site is between L3 and L4 vertebrae, and the position given for the patient is C-shaped position. C-shaped position with full flexion of spine.